Hey mama, so you may have heard before that as long as you're breastfeeding, you can't get pregnant. And it seems that for some people that's true, while for others, it's clearly not. So in this video, we are talking about how breastfeeding impacts your ability to get pregnant, as well as a natural alternative method for family planning. I'm Bridget and I'm a doula in the San Francisco Bay Area, and I love helping moms love their birth so they can confidently step into motherhood. Don't forget to subscribe to my channel and hit the little bell on the side so you don't miss any of my videos that will help you navigate your pregnancy, birth, and motherhood. So why is it that you hear some people say that breastfeeding was their birth control and others say the opposite? Well, to start this conversation off, it's important to remember how women's cycles work. Now, I'm sure you all know this already, but during a certain time each month, an egg is released from an ovary and travels down to the uterus to implant if it has been fertilized by a sperm along the way. But if the egg remains unfertilized, the lining of that uterus that has been thickening with nutrients in preparation for that fertilized egg to implant and begin growing will start to shed, resulting in a period that lasts anywhere between 2 to 7 days. Now, while a mama is breastfeeding, especially during the first 6 months after birth, the likelihood of her ovulating is very slim. And the reason for this is because the act of baby sucking triggers a signal to the mother's brain that actually interferes with the production of hormones that are needed to ovulate. In fact, for the nursing mother, there's really only about a 6% chance of pregnancy occurring prior to the first menstruation. Do keep in mind, though, that you ovulate before your period, which means you can get pregnant before that first period, even while you're breastfeeding. However, there is a way that you can reduce that 6% chance of getting pregnant while breastfeeding, and this little method is why some women may postpone getting pregnant, whether they know they're doing this method or not. And the method that I'm talking about is called the Lactation Amenorrhea Method, LAM for short, or Ecological Breastfeeding. And using these methods can lower your chance of getting pregnant in the first 6 months to about 1%. So what exactly is LAM or ecological breastfeeding? Basically, these methods use breastfeeding as a way to help mamas prevent getting pregnant. But there are a few conditions that have to be met in order to get the desired results from LAM. To remember these requirements, we can use the abbreviating letters LAM. And the first letter L is for lactation. So you can ask yourself, am I exclusively or nearly exclusively breastfeeding my baby? And what that looks like is frequent feeding. So feeding on demand or feeding about every 3 to 4 hours during the day and at least every 6 hours at night, and without regular supplementation of food, water, or formula. Now, if supplementing happens more than 1 to 2 times a week and it disrupts normal feeding times, or in other words, you're supplementing and you're not expressing milk from your breast, then this criteria isn't being met and you're more likely to become pregnant if you're using the LAM method. The next letter is A for amenorrhea, which basically is just a fancy term for your period. So has your period returned? Now, of course, after birth, you're bleeding for sometimes up to 6 weeks after baby is born, and this is not considered a period. So a period is considered to be after your postpartum bleeding has ended, and then you experience menstrual-like bleeding again lasting 2 to 7 days, just like in a typical menstrual cycle. So once your postpartum bleeding has stopped, and then in a few months you have you're bleeding again, that's probably your period. And if you have started your period, you're no longer amenorrheic, which means you're more likely to get pregnant. The last letter M stands for months, and the first 6 months is when LAM is most effective because most exclusively breastfeeding mamas don't get their period back within those 6 months if they are breastfeeding at least every 4 hours during the day and at least every 6 hours at night. Now, this isn't to say that once that 6-month mark rolls around that the LAM method is totally ineffective. In fact, there have been studies done in Rwanda where women who maintained breastfeeding frequency through 9 months were able to effectively avoid pregnancy. And beyond those 9 months, a study done in Pakistan showed that frequent feedings day and night could work as birth control for up to 12 months. So really what it comes down to is the frequency of feedings. And if you want to use this method, you want to make sure that you are feeding baby very, very frequently. And usually at that 6-month mark, babies begin to eat more solids and rely less on breast milk, which is often why those feedings become less frequent. So when this is the case and mamas aren't feeding as often as before, the chance of ovulating increases. So bottom line is that for a mama who hasn't had a period yet and is exclusively breastfeeding through the day and night in a especially with a baby who is less than 6 months old, has about a 1% chance of getting pregnant. The U.S. Department of Health and Human Services states that LAM is a highly effective method of contraception if mamas are meeting the requirements. However, if you're a pumping mama, this method might not necessarily work for you because studies show that manually expressing milk increases the chances of getting pregnant over your baby directly nursing from the breast. So it's definitely something to consider and just be looking out for. So this is a chart that I'm going to show you from Institute of Reproductive Health, and you can tell from this chart that LAM is actually very effective in preventing pregnancy next to other birth control methods. So oral contraceptives, as commonly used, as in maybe you're not taking them at the same time every day or you miss a day, has an 8% chance of pregnancy, while commonly used LAM is only 2%. Now, if you want to look closer at that chart, I'll link that down below in the description. So that's a basic idea of how the lactation amenorrhea method works, and ecological breastfeeding is very similar, although a little bit more strict on their guidelines. Ecological breastfeeding usually means not offering baby any supplements at all, no pacifiers, and encourages co-sleeping or at the very least room sharing so that you can nurse basically around the clock. But basically, it's the same idea, nursing exclusively, haven't had a period yet, and baby is under 6 months. And in my opinion, LAM is a little bit easier to follow and allows a little bit more freedom and flexibility for mama. So figuring out what's best for you and your family is important, and this is just one method for family planning that focuses on a more natural approach. I hope this video also answers your question about whether you can get pregnant while breastfeeding, because yes, you can, but there are ways that you can help avoid getting pregnant if you're hoping to space out your babies a little bit more. Thanks for being with me in this video, mamas, and I will see you in the next one. Bye!